So in our study of people who are homeless in Toronto, we found that there was a very high rate of emergency department use. In fact, people who are homeless visited the emergency department more than 8 times as often as people in the general population. However, this wasn't spread out evenly among the homeless population. In fact, a small proportion of the homeless, about 10%, account for more than 60% of all emergency department visits. What this tells us is that we can focus our efforts to intervene and improve the health of these individuals and reduce their emergency department visits by focusing on this 10% of high utilizers. What our research shows is that this high rate of emergency department use is driven not just by inappropriate visits to the emergency department, but also by very high levels of illness and very high levels of need for care. And so we need to develop interventions that actually provide the care that these people need and prevent them from coming to the hospital by meeting those needs. We can do that by focusing on a very small subgroup of the homeless population that accounts for a large proportion of emergency department visits. So in the United States, people have often thought that people who are homeless use the emergency department because they don't have health insurance and they have no other place to seek care. This study was done in Canada, where there's universal health insurance, and all of the individuals in our study actually had insurance. In other words, even if you provide people who are homeless with health insurance, universal health insurance, their rates of emergency department utilization remain very high. So at St. Michael's Hospital, we both do research on the issue of homelessness and try to develop solutions to the health issues of this population. We have an intervention called Catch ED, which is actually trying to reduce healthcare emergency department utilization and improve the health of people who are homeless and frequent emergency department users. We do this through a combination of case management and efforts to connect people to housing and treatment that can both improve their health and reduce their visits to the emergency department. So we actually were able to assess people's healthcare use in both physicians' offices and the emergency department, and what we found is that people who are homeless are not using the emergency department as a substitute for a family physician. In fact, many of these individuals are receiving care in clinics, but are also coming to the emergency department. So what this demonstrates is that they have a high level of healthcare need, and in fact, in addition to the care that they're receiving, they need something else. They need an additional intervention to try to reduce their emergency department use. Our next step is to focus on intervening to help improve the health and reduce emergency department visits by this small subset of the homeless population that are very high users. This effort is really challenging because these individuals have complex physical and mental health needs, and we have to address the needs of the whole person rather than just focusing on the fact that they are coming to the emergency department frequently.